Hello, I'm Cheryl O'Malley, Associate Dean for Graduate Medical Education at the University of Arizona College of Medicine, Phoenix. I'm thrilled to welcome you and to share information about our GME programs. Our residents and fellows benefit from learning in a large health system with a vision of making healthcare easier. Our medical school is invested in developing you as an educator and a leader. We are located in the heart of downtown Phoenix, so you will get to see diverse patients referred from all over the state. Our commitment to inclusive excellence recognizes the value and contributions of diverse trainees, faculty, and staff who bring rich individual experiences to enhance our care for our patients and our community. We look forward to you learning more about how our College of Medicine Phoenix program fits with your career and professional goals.
Hello, my name is Michael McKee, and I am the Professor and Chair of the Department of Orthopedic Surgery at the University of Arizona College of Medicine, Phoenix. I'd like to welcome you to our program and give you a little update on where we are and where our program is going and why I think you'd really enjoy it here. One of the nice things about the Department of Orthopedics here is that it is a relatively young department. We've only been around for about 12 years or so, and so we don't have a lot of the set hierarchy and rules that have often plagued, I think, some other departments in this era of rapid change. We are young and relatively small, but we're flexible, we're forward-thinking, we focus on evidence-based medicine. We try and create an environment where everyone in the room has a voice and everyone's opinion is heard in a diverse and open type of situation. So we encourage diversity in our program. We are recruiting along those lines. And we want the situation in our department to be one where everyone has a voice and everyone can say their piece and is listened to. And that's something I think which is critical in our environment. We want our department to reflect the population that we serve. We want to be in tune to cultural changes and cultural differences. And I think that's something that we all strive for. We have a great program director in Dr. Chutkin who shares those values, and I think that going forward we're going to have an open, diverse, collegial group with focus on evidence-based medicine, and we have some interesting research going on as well, allied with other divisions and other departments in the hospital and the surrounding healthcare system. And I really think that there's no limit on the things that we can do with the right people in place.
Hello, my name is Norman Chutkin, and I'm the Program Director for Orthopedic Surgery here at the University of Arizona College of Medicine, Phoenix. In our department, we take 4 new residents every year. We are structured in a mentor-type program with progressive responsibilities. We have exposure to all the subspecialties, including orthopedic oncology, spine surgery, orthopedic trauma, foot and ankle surgery, among others. There is a wide breadth of operative experience starting at a very early stage. We also emphasize didactics with predicted didactic time on Wednesday afternoons. Our program has scored in the top quarter percentile in the orthopedic in-training exam for the last couple of years as a reflection of the success of our didactic program. We believe that this is a very congenial and outstanding program, and we are very glad that you have taken an interest in us.
I'm Donnell McDonald. I'm a second-year resident, and I'm currently on my musculoskeletal oncology rotation. I work with Dr. DeComis, and we do a mix of arthroplasty, musculoskeletal oncology, and also trauma cases. Typically, we are in clinic 2 days a week, and we operate 3 days a week. You see a variety of cases, mixes everything. It's a very hands-on rotation. She definitely gets you involved, and I'm definitely enjoying my time on here.
Hi, I'm Dr. DeComis. I am the orthopedic oncologist at our program. It's awesome working with residents. We do a big mix of cases. I do a lot of arthroplasty as well and some trauma. So lots of diversity. I have 3 kids. I'm married to a pediatric orthopedist, and we look forward to meeting you at the interview.
So to diagnose an oncology patient, you want to start with the history and physical. Next, you want to move to imaging, and of course, advanced imaging if needed. A lot of the diagnoses will require a biopsy to determine what they are. And from there, we typically plan a staged procedure to help treat the patient, and we also get medicine oncology on board to help manage these patients also.
There's a family feel here, with collaboration and learning across our programs so that we can support your education and well-being. We're excited for you to consider joining our family.